The issue of the pandemic is a very serious matter indeed. So we support wholeheartedly and totally President Ramaphosa's leadership in instituting this lockdown, that we're fully behind it ourselves, because we want to make sure that the issue around the pandemic is actually being handled. However, having said that, we don't have one evil that is facing South Africa. We have two. The other evil is the economic collapse that we have to make sure that we're trying to prevent. So to that extent, wherever it is possible to see those sectors that can go back to work, such as the fast food outlets, we will insist that, number one, they should go back by ensuring that they do not aggravate the situation of the pandemic. In other words, mitigation factors that should be built around people who go back to work, such as, to answer your question finally, all the staff members who go back to work should be tested before they go back to work, to ensure that they are not infected, to ensure that they are not infectious. Number two, as they are at work, they should be provided with all the necessary and relevant personal protective equipment, masks, gloves, whatever it is that they need. Number three, the issue of the transportation of those people who go back to work to and from home should be handled with the highest level of hygiene that is necessary, okay? So that when they go home, the social distancing is protected, the mode of transportation that they're using is going to be like that. Number four, the customers who come to collect their food, drive-through, must be done in a way that is safe. Number one, social distancing again. Number two, deliveries that are going to be made to your house. If you've ordered a Nando's chicken with chips and Coca-Cola, whatever the case might be, the delivery person should be someone who has also been tested and found to be negative of the COVID-19 virus. And their equipment, their bicycle, whatever they're handling, must also be disinfected. And then number four, when we get to the stage of doing the click to call, the call and collect, we need to make sure that when you don't just show up at the KFC to come grab and wait in the queue. You would have called first, you would have ordered whatever you're ordering, and then you show up because they've told you your food will be ready in 20, 30 minutes, to make sure that we avoid any queues that may well arise outside. So no walk-ins, call, collect. And that's what we're actually saying. And we believe that if you do that, you can then create a template for which of the sectors, as the President himself has said, we need to start working over the coming days on sectors that can recover very quickly and get back to work, because we cannot sustain a lockdown over months. Because as the American Dr. Fauci says, you cannot set a time on the virus. The virus itself will set the timeline. So our fear is that we may come to June, July, we would not have the level of sufficient data when that high season of infections comes up to understand what we're doing. So we need to find a way and means of living with the virus, making sure that we don't aggravate the situation when we say this sector must go. So the fast food sector offers us the low-hanging fruit in terms of the test case. Let's see how we can do with them, because we know we can put those measures in nice and quick. And then after that, we can start investigating scientifically, not just theoretically, with practical steps of how do you want to go back to work and protect the public from this pandemic. That is what our position is.
So, Mr. Mokoki, here's the spanner in the works. All the processes that you are suggesting be undertaken to ensure that the people who provide the food provision services undergo are already held up elsewhere. The President and the Minister of Health, Dr. Zweli Mkhize, are already concentrating all of these efforts and into the fight against COVID-19. It'll require skills to come and then extend this process to come and test people in the food services. How do you suggest we go about this?
We have said very clearly, we're doing controlled and measured. In the final analysis, the government itself is going out to do mass testing in any event. Where you want to go to people's homes, you want to go and check them for any signs of infection, and those who actually show symptoms of infection, then you're going to go and get them tested. We don't have a choice. It's not like we can sit in a lockdown for 3 months or 4 months. This economy will actually collapse. So we have to do whatever it is necessary testing people who are going to go back to work when we work together with government, the private sector and government together, is not something that is so insurmountable. It can actually be done. As you say yourself, the government is already doing it. So we then say, let's focus on the people that we need to get back to work as well to ensure that that actually can be done. If it needs resources, let's throw money at the problem.